You ready for this one? Informed consent is literally the entire basis of this whole course. So it's really, really, really important to me that you fully understand what this informed consent is, what implied consent is, what informed refusal is. All of these concepts are the absolute foundation of, first off, the medical care that we receive. It is a legal requirement for every single person who is in a medical professional role and involved in your care. It is a legal requirement and obligation for them to receive informed consent from you. You can also refuse things. So informed refusal is a huge deal. But if you take absolutely nothing away from this course, this is the thing I want you to take away from it. This is your ability to ask questions. This is your ability to understand. So this whole section right here is going to be discussing informed consent, informed refusal, how to talk to your provider, what the requirements are. And I genuinely mean it. This is the most important piece of this entire course, because I can teach you a million things. If you get into the situation and you're like, hey, I don't remember anything, and that's okay, because that sometimes happens. You will have heard the words before, but now you know. And this, partners, huge deal for you too. This is a huge, huge deal for both of you, because you will know how to stop a situation and ask questions and make sure that you have fully received the information that you need to feel safe and supported, which is going to make sure that the whole rest of your experience is what it needs to be. Okay, so this is it. This is the important part. And it's up here at the front because I want you to understand it, and I don't want you to get too bored while you're scrolling through the other things. I will try and keep it as concise as possible, but I really want you to kind of get this. And like, there's handouts, the handouts that you have in the class, in the links up above, they're all going to be there as well. You can print these, you can take them with you, you can look at the little tricks and stuff that we have, but it is really important to understand. Okay, so what is informed consent? Informed consent is making sure that the person who is going to provide any type of medical service or intervention to you has explicitly explained all the ins and outs and backwards, the alternatives and everything else for what it is that they are doing. And that's it. It's a very simple concept, but they actually just have to get your full, uncoerced, like willing participant informed consent. So I'm going to share my screen with you here. We will go through this. Informed consent is understanding the nature of the procedure. What's going to happen? What are the steps? Why are they choosing this particular thing? This is a really huge deal when we start to talk about inductions. So this will be coming back up through the entire course. Inductions, for example, why are they choosing Cervidil over choosing starting Pitocin, over breaking your water, over a balloon catheter, over all of these different things? Why is this the best option? Why are they choosing this? You have to understand that there is choices being made. When somebody is telling you that there is an option for something, a choice has been made. They have decided, proing and conning in their head, that this is the best, safest option for them to suggest for you. Or maybe it's the most convenient for them. It's hard to say, right? So you have to ask those questions. That's a big thing. So what is the nature of the procedure? What are the risks and what are the benefits? This is a big one here. What are the risks to do the procedure? There is always, doesn't matter if it is taking a blood pressure, the risks of doing a procedure for a blood pressure, potential risk for bruising, potential risk for discomfort because it is an inflating thing on your arm. It doesn't feel good. Potential risk for a false reading, having to redo it again, all kinds of different things. What if you don't do it? So this is a huge thing. This is not just like you have no choice but to do it. You have a choice in every single possible thing that is ever going to happen to you. You will always have the choice. You always, always, always have the option. So what if you don't do it? What's the outcome? What are the pros and cons if I don't do it? Is it okay to wait longer? Do I need to do it now? Is it an emergency? Those are questions you can ask. What are the benefits if I do? Benefits are a really important thing. That's usually where people focus. You focus less on the risk because it makes things sound scary. But in a way, if you are not told the risks so that you fully understand them, that is coercion. You can't be coerced into something. You have to know what the pros and cons are. Having these conversations, and we're going to talk a little bit about actually having these conversations with your provider after in the next video, but it is a really big deal, and having these open conversations so that nobody gets their back up is another really big part of it. And what if I don't do it? That's it. So that is the big thing. Risks and benefits of the procedure. There's always risks, there's always benefits. When it comes to making decisions for this, you need to understand them. Reasonable alternatives. So like I mentioned earlier, there's many different alternatives for inductions. What are the reasonable alternatives here? What if something feels better to you than it does to your care provider? These are really important things. So there are other options available for almost every situation that you will ever get into. There are other options available: pushing positions, breathing techniques, coping techniques, medications, position, or like places that you want to give birth. There are always options. What if you do nothing? I keep coming back to this as a huge piece of it. If you do nothing, what are the potential consequences? What are the potential benefits? So that is a big piece of it. The risks and the benefits of the alternatives, not going to get into that because you know exactly where I'm going. You need to know and you need to understand all of those. And then assessment of understanding of all the elements. So it is an actual obligation that your care provider deems you, first off, competent, capable of making a rational decision, and actually giving expressed consent. There are different types of consent. There's implied consent, there's, informed verbal consent, there's written consent, all these different things. We're going to talk about that in another second, but understanding all of these elements, what are the risks, the benefits, the alternatives put together, that is actually a legal requirement of your physician. So the BRAIN acronym that you can see over here is a really quick and easy way to remember this. So BRAIN, benefits, risks, alternatives, intuition. This part is left out often, and I really think that it is incredibly important. As much as you may want to trust blindly what is being told to you, your gut has got some say in this. And the more that you listen to your gut and say, something's not sitting quite right. Maybe I just need to ask one more question to be able to say I fully agree and commit to this. Or maybe it's one of those situations where you're like, this isn't really sitting well, but I'm not hearing any other alternatives. Let me dig into this further. Let me ask some more questions, right? And then what if you do nothing? That's always a big deal. So understanding that there are these different pieces of it is really important, because it helps you to be able to understand what it is that you are having done, what it is that is being suggested to be done to your body, and what the possible alternatives are. I also just want to show you here, these are two of the handouts that I have. So this information has come directly off of the CMPA. Basically, what it is saying, like, implied consent is given or implied. So you arrange a medical appointment, you keep the appointment, you volunteer your history, you answer the questions relating to the history, you submit without objection to a physical exam. Okay, that is considered implied consent. This last piece of it is where I really struggle with that. You submit without objection. You are always allowed to object. So you walk into a doctor's office, they say, okay, time for your PAP. You're like, I wasn't prepared for that. I'm not ready. I don't feel comfortable with that. But they're saying that it is implied consent as long as you are actually submitting to this. People with a history of trauma, people who have people-pleasing tendencies, if you have any type of history of not being able to say no, or being triggered when that's the case, or worried about, will they not see me as an easy patient? Will they be mad at me? That type of thing. This is where this piece of it really, I have a very hard time with, because a lot of people struggle with terribly. So not getting into the situation where this could implied consent happen. You could say, okay, I'm actually just going to keep my pants on. And this, it sounds, like lighthearted or whatever. I don't mean to be, but instead of, okay, well, they're going to do a PAP today, so just make sure that you take off your pants before the doctor comes in, so that they can just do it right away. Well, if you don't feel comfortable and your gut is saying like, no, not today, listen to that. You don't have to take your pants off. You can have them come in and they'll be like, oh, why don't you have your pants off? Why aren't you ready for the exam? You're like, I have questions. And then you can decide whether or not, once you ask those questions, if it feels good. This is a huge piece. Does not mean that you have to continue consenting just because you are there. You can stop consenting partway through. I'm so glad that our society is now teaching consent to younger and younger kids. And it is such a huge piece of understanding intimate partner relations and all of this stuff. Consent is essential at all times. It can be withdrawn at any moment without repercussion. The issue is that once things have started, a lot of the time they're like, oh, well, we're already doing it. Why would you say no now? This happens with oxytocin, with Pitocin inductions a lot. Well, you're already on it. You can't come off it now. That is not true. That is not the case. You can always stop consenting and withdraw. Same with epidurals. It'll take a little bit of time for it to wear off, but they can turn it off and they can remove it, right? So expressed consent is different than implied consent. It must be in oral or written form, should be obtained when the treatment is likely to be more than mildly painful, i.e. pelvic exams or cervical checks is a big one for this. When it carries appreciable risk, so any medication that you could possibly be given, continuous versus intermittent monitoring, we're going to get into all of this stuff, but this is the basis of it. Or when it will result in an inabulation of the bodily function. Something is going to impact your body's function. Express consent in written form should be obtained for surgical operations and invasive investigative procedures. Often we find that you're given a package ahead of time in pregnancy that they'll just like give you an informed or not an informed consent. It's not informed consent. They will give you a consent sheet that they're like, oh, just fill these out. And it will be consent for induction. It will be consent for C-sections. It will be consent for all of these different procedures. This doesn't always happen, but it does happen for some people in some hospitals. But what you can avoid doing is signing those ahead of time. It is not informed consent unless you are truly given the talk that it's super important that you understand XYZ is the benefit, XYZ is the risk, blah, blah, blah. Just signing a piece of paper does not give expressed informed consent. So it's actually not as valid as what it seems like it is. They're just trying to kind of save time, basically. So you may revoke express consent at any time before, during, or after, well, not really after, but, before and during the procedure, after it's already done. The required elements of consent, it is voluntarily given. You have the capacity, i.e. you have the understanding, and it is properly informed. When you are in agonizing pain, your brain function is not at full capacity. You are not able to make full rational decisions when you are in the midst of labor. That is why we're learning this stuff ahead of time. It is essential that you understand and learn this stuff ahead of time so that you really know what it is that's going on and what you've got coming kind of possibly down the pike for you. So in the medical context, as the law on consent to medical treatment has evolved, it has become basic accepted principle that every human being of adult years of a sound mind has the right to determine what shall be done with his or her own body. Clearly, physicians do not or may not do anything to or without patient's consent, valid consent. This principle is applicable not only to surgical operations, but to all forms of medical treatment and diagnostic procedures that involve intentional interference with that person. This statement was released from the Canadian Physicians Association in April of 2021. It is part of their mandated practice. This applies for nurses, this applies for respiratory therapists, this applies for anesthesiologists, this applies for everybody, midwives as well. They have different wording in all of the different regulatory bodies, but you will find it in one way or another on every one of our medical professional sites. So this sort of just goes over what we had already talked about, understanding the nature of the procedure, all benefits, all risks, all reasonable alternatives, the benefits and the risks of the alternatives, and making sure that your healthcare provider has done an assessment of what your capacity is. It must be obtained in a non-threatening, non-coercive manner. Healthcare practitioners should be seated at eye level using language that fits your understanding. You must be met at the intellectual reading and comprehension level that is most appropriate to you. Talking down to or oversimplifying things is not appropriate as well. Okay, so these are just straight up things that you need to get. Informed refusal is the exact same but the polar opposite of informed consent. Delaying or refusing treatments, procedures, or interventions with a full understanding of the risks and the benefits. This can be an appropriate call for any non-imminent, life-threatening decisions that have to be made. You will be told when there are imminently life-threatening decisions. It will be very obvious that somebody will say to you, this is a life-threatening situation, or this is an emergency, we have to act now. If you are like, hey, this doesn't feel right, I feel really like under pressure, sometimes that feeling is not going to go away, which definitely becomes a little bit of a situation where it can be very traumatic, understandably so. But if there is any hesitancy around the time frame, so you can say, is this an emergency? Do we have to make this decision immediately? And if the answer is yes, you know what your answer is. If the answer is, no, well, but we have to soon, you now have time to be able to ask the questions that you need. You have time to say, hey, I need 5 minutes. I need 2 minutes. I need whatever. Please leave the room. My partner is going to come and get you as soon as we are ready to discuss this fully. But we need some time to ourselves to discuss this. Everybody, please step out. Okay, so you have these options. We're going to chat about a couple of different things here soon. Head over to the next video.